Peter Marshall Murray, black physician, born 1888, died 1969. Peter Marshall Murray was a physician and surgeon whose specialty was gynecology and obstetrics. With his extensive clinical experience, Murray's primary area of interest were gynecology surgery, pelvic inflammation and infection, uterine fibroids complicating pregnancy, and milk injections. As a talented doctor, Murray achieved a number of firsts for blacks in medical associations and societies. He also used his prestige to support access to quality medical care in hospitals for African Americans. Murray was born on June 9, 1888, in Houma, Louisiana, one of four children of John and Luvinia Neesmith Murray. His father worked as a longshoreman, while his mother was a laundress. The family moved to New Orleans in part to seek better educational opportunities for their children when Murray was 12 or 13. In New Orleans, his father found work as a stevedore, and his mother became employed as a practical nurse in New Orleans Women's Hospital and Infirmary. Her experiences there led her to inspire her son to become a doctor. Murray earned his B.A. from New Orleans University, later known as Dillard University, in 1910. While in medical school at Howard University, Murray had to work to send money home to support his ailing mother. He found a job as a security guard and studied as much as he could on duty while his co-workers covered for him. Murray graduated with his M.D. with honors from Howard Medical School in 1914. Upon graduation until 1920, Murray worked in the Washington, D.C. area, in addition to establishing his own private practice. For the first year, 1914 to 1915, Murray was an intern at Bellevue Medical School at Freeman's Hospital. In 1915, Murray began work as an assistant to the dean and a professor of surgery at Howard University. From 1915 to 1920, Murray was a clinical instructor in surgery at Howard. He also spent a year as the medical inspector for Washington, D.C. public schools from 1917 to 1918. In 1918, Murray was named Assistant Surgeon-in-Chief at Freeman's Hospital, another post he retained until 1920. Murray married during this period. On July 2, 1917, he wed Charlotte Wallace, a music teacher and concert singer, and they had one child together, John Wallace Murray. In 1920, Murray and his family moved to New York City, where he spent the rest of his life. Murray did some postgraduate work at the New York Postgraduate School and Hospital, Columbia University. By 1921, Murray had established a medical practice in the city, and while he was immediately successful financially, it took some years to develop professional respectability. For the first 15 or so years of Murray's career in New York, Murray performed surgery at a private institution, the Wiley Wilson Sanitarium, operated by his friend Dr. Wilson, because many hospitals were closed to blacks. Murray began his association with Harlem Hospital in 1925. Some sources say 1928. He rose through the ranks at Harlem Hospital, beginning as an assistant adjunct visiting physician to the director of gynecology, then a member of the surgical staff, and was director of gynecology when he retired in 1953, after 25 years of service. Murray also was associated with a number of other hospitals during the period of 1924 to 1964, including St. Clair's Hospital and S.T.E.M Hospital, New York City, and Beth Israel Hospital, Newark, New Jersey. At one point in 1953, Murray was the director of obstetrics and gynecology at Sydenham. He was also one of the first African American doctors appointed to Sydenham's executive committee in 1944. While in New York City, Murray remained loyal to Howard University. He formed an informal local alumni society and medical reading club, and he was a trustee of the university from 1924 to 1958. Murray was also a trustee for the State University of New York from 1954 to 1959. Then, New York Governor Thomas Dewey appointed him as trustee, and Murray served as chairman of its Committee on Medical Education. Murray also held a membership in the President's National Medical Advisory Committee on Health Resources. Throughout the 1930s, Murray garnered many honors. In 1931, Murray was the first African American to be certified in gynecology by the American Board of Obstetrics and Gynecology. He served as president of the National Medical Association, the African American Physician Organization, from 1932 to 1933, and served as president of the North Harlem Medical Society in 1930. Murray also served the National Medical Association as chairman of the Publications Committee from 1942 to 1957. In 1954, he was awarded a Distinguished Service Medal by the group. Murray remained active in the medical community upon his retirement. He was president of the New York County Medical Society from 1954 to 1957, the first African American to serve in that capacity. He was named a member of the Board of Hospitals in New York City in 1958. This was a considerably prestigious position because in that capacity, he directed 29 hospitals in New York City. Murray was also the first African American on the House of Delegates of the American Medical Association from 1949 to 1961. He used his position to advocate for an end to segregation in the American Medical Association's component societies. In 1969, the New York Academy of Medicine awarded him a plaque for distinguished service. He was a member of numerous other professional organizations, including the American College of Surgeons and the International College of Surgeons. Murray was awarded several honorary degrees throughout his career. DSc degrees from Dillard University in 1935, Lincoln University, Pennsylvania in 1944, and Central State College, Ohio in 1962. In addition to all his clinical and societal work, Murray managed to publish regularly from 1922 to 1965. He died on December 19th, 1969, at St. Clare's Hospital, New York City. Citations are in the description.